So EGP learners, we've just listened to Wes Streeting's speech live at the RCGP Annual Conference 2024. An interesting speech. He did point out he's the first health secretary to come to conference in over 7 years. There was a little thing like COVID in the middle of that, but a correct statement as well. Andy?
Yeah, I think it's really good. So I guess what we're going to do now is just talk about what was said at the speech, get our initial kind of quite hot reactions. We're in a stairwell corridor at the RCGP conference, just giving our initial thoughts and getting them out there. We talked about his speech, and then there was some really good Q&As actually afterwards as well. And I think we got a little bit more insights into maybe his kind of thinking as he was ad-libbing and off script a little bit more for those responses. So that was really interesting. Shall we have a talk?
Yeah, I guess just to give you, it was a slightly different format to the standard way that they tend to do these speeches. So actually they started off by giving 4 GPs spotlight of a few minutes just talking about some of the changes they made. And I think partly that was structured if you think about it. There was very much the whole concept of GPs willing to change, focus on continuity, looking at service provision across different areas, and also using technology in innovative ways to try and help improve patient care. And I think that was probably creating a message that allowed them to, the RCGP to basically focus more on the talk, and then the introduction of Wes Streeting from there, and then his speech, which lasted about 15 minutes in total.
Yeah, absolutely. Yeah. I think the college very much sort of setting the scene, and of course you've got the Secretary of Health there, and he has to listen to those speeches as well. So if you've got some messages that you want to drive home, then it's a really good place to put them. So Wes's speech. So I guess one of the first things he said, we'll just sort of take his points in order really, and then reflect on it. But he's first Health Secretary to come in 7 years, and he's committed to coming back next year. He says. So I guess that's
we will see
that he can be held to. That's a very firm pledge. I guess with the language that he used, so he talked about team spirit, working with the 2 million people that work in, I'm not sure whether that's the NHS or the NHS and the social care system. I think it might be both of those. Committed to honesty, talked a lot about that. We heard some, I don't know, shall we call them party lines, talking about broken Britain, 14 years of underinvestment, came up a number of times as well. Acknowledging that GPs lack resources, so there was some honesty there, which was good. Acknowledging there's 15,000 fewer GPs. And actually some interesting comments. He talked about productivity in secondary care falling in recent years, but acknowledging that Darzi in his report and himself acknowledged
the Darzi diagnosis. So he said this quite a few times. He kept referring to the Darzi diagnosis. They love their alliteration in these speeches and stuff. And we'll come to some of those other ones in a second. But very much focus on how Darzi's report suggests there needs to be further investment in general practice, and the difference between general practices and secondary care. And that came up in one of the questions as well, which we'll come to, which was really interesting.
It did. And acknowledging that productivity in primary care and general practice has been increasing at a time when it's been falling in other areas, according to the Darzi diagnosis. Some interesting comments about capital spending, and that came up in one of the questions as well, but there seemed to be an acknowledgement that there needed to be spending on estates and space for people to work from, which is something that the college and the BMA and everybody talks about being a big problem. Acknowledging continuity of care matters. So that followed on from one of the introductory talks from one of the GPs, actually, but really acknowledging that drives better patient outcomes. So that was interesting. And he talked about the neighbourhood health system. I think I've heard that before, as well as the national health system. They talked about the Darzi diagnosis and the 3 themes that come from that are going into the 10-year plan that's currently being consulted on by the government.
Plan. I'm not too keen on that. Another plan after we just had the long-term plan just a couple of years ago. So
yeah, but then we also asked them to change direction, don't we? And there's things that we don't like about the current plan. So you can't have it both ways, can you?
I know. What can I say?
So the 3 themes, I guess, it's hospital to community, analog to digital, and sickness to prevention. Yeah. And he acknowledged actually that we've heard those things before. He did say that, but he is committed to it. Talked about, so this was an interesting part for me. So talked about, we listened. There was an RCGP petition about including GPs in ARRS funding, and that has happened with an additional £82 million additional funding on top of what was already available from other routes. And there was a big funding increase to the core contracts, which wasn't necessarily widely expected as well. I think it was at 5.7. I'm getting there.
So in total, it's 7.1%, including the previous 2.1% uplift. There is some more peculiarities on that, which we hopefully will cover. Some of the BMA have done a more detailed analysis, and actually it's not as much as people are thinking, which is going to have an impact on practices, and we hope to come to you on that soon. But yeah, there has been a capital increase for practices. There's the GP&Rs, which we've talked about ad infinitum, and how actually, yes, it's £82 million. It may not be as good as it sounds.
So he made that point, and then he went on to talk about paperwork and red tape, and cutting paperwork and red tape in primary care.
Bulldozing bureaucracy. Like I said, they love their alliteration in these speeches and things. So we definitely heard some of those Boris-esque.
Yeah, sort of Boris-esque comments. So that was interesting. And then moved from that to a slightly less popular point in the room, where he called for GPs to call off their industrial action. So that was interesting, and came up in one of the questions later.
It did, and a rather interesting response from Camilla, who was chairing this, obviously as chair of the RCGP. She quite rightly said, actually, that's something you need to direct towards the GP. So this is not the remit of the RCGP to respond to, but noting that as a request.
Yeah, and Wes Streeting was quick on his feet with the last question as well, because it was about IMGs and visa rules, and he pointed out, well, Camilla, I'm afraid you'll have to direct that question to the Home Secretary. That's not quite in my wheelhouse. So
although
that
he
was
did say that the point had merit. So
yeah, he did say the point had merit. Yeah, and we get the. He talked a little bit about tension between the Treasury and Health, actually. I'm sure there's always tension between the Treasury and other departments, because they want money, and the Treasury's job is not to necessarily give them everything that they wanted to challenge them. So maybe that's not unusual that there was tension. But it was vocalised, which is interesting. Let's see what else. We're nearly at the end here. Yeah, so after that point about calling off industrial action, he quickly moved on to talk about how genomics and personalised medicine is going to revolutionise cancer care. So kind of just really changed the topic quite quickly. Some things about patient record. So he's talking about single patient record owned by the patient, and also how data is the new gold, or the new tax that we pay is our data. That was a very interesting way of putting it. You might have some thoughts about
so there's a suggestion that we may possibly see the resurgence of very much early doors, but possibly the resurgence of something like GP-GDPR and all those kind of data sharing stuff. That NHS England will be responsible for that. Now, we've heard that kind of rhetoric before. Obviously, there is no detail, there is no commentary on that at this point, but I think his response was, I'm going to make this easy on GPs, I'm not going to make you do it, I'm going to give it to NHS England. My caution with that is actually previous attempts done by NHS England have screwed over everybody, and actually, no detail, but the GPs are the data controllers. This is the key thing, the liability is with them. So I think when that comes through, we will absolutely cover that on the channel, won't we, Andy?
Let's see what happens. But yeah, the phrase collectivist approach to data, I thought that was interesting, talking about collectivism. And then he went back to let's pull together, let's work as a team, and that was the end of the talk.
Effectively. We did get the Q&A, so we talked about some of those. The first ones being around the GP&Rs scheme, and how effective is that going to be, and is that going to be committed to? He did state that funding will continue into the next year. He didn't state how, but that was a clear direction.
I didn't pick up on that. I'm sure he said it. I'm sure I was busy typing some of these.
So he did say it was going to continue, but he didn't say how it was going to continue. So it may not continue in the same way, which I know is something we theorised when we covered the GP&Rs.
I was straining to actually hear a response to that question because I felt he'd quickly moved on to talking about the wider determinants of health and health inequalities, and talked for quite a long time, and was maybe chewing down the clock a little bit, I thought, at that point. But actually he handled some of the later questions pretty well, and was quite frank and direct about them.
I believe the next question was the one about the immigration aspects of GPs, and talking about the fact that obviously we have a significant portion of IMGs coming to train as GPs, but actually they are then pretty much told they may have to reapply for their visas by the time they complete, and can we not look at a similar system to Australia? That was the tension point you mentioned.
Where they get indefinite leave to remain on completion of training in Australia. Can we do something similar? Yeah, this is where he talked about challenging Treasury thinking, about things being cheaper, and he also talked about working with the Home Secretary to reduce net migration, and that felt like that was a message not for the audience in the room, but probably for the audience watching outside, in a bit of a party line on immigration. So that was interesting response.
We did have a question then about the Darcy diagnosis, and the fact that it does highlight the merits of GP partnership, and again, an interesting commentary by him. He admitted that his earlier points in the year, when he basically said, I want to scrap the GP partnership, was an intentional aspect to start the discussion.
What imagines if there's a little bit of a kind of a reimagining of the past here, a bit of retconning of what happened.
Possibly.
But that might have been his
communication officer was on leave at that particular point.
But he did say that he's listened, he sees the benefits of the partnership model. It is productive, it is innovative, it is entrepreneurial, and the question is now about what the future of the partnership model looks like to arrest its decline. So those were the words, so that's good. And then he said, I didn't think it's a first order concern, which was interesting, which suggests maybe they're not really wanting to do very much about it.
We'll be interested to see what happens. Very much a lot of the commentary was around, we need to wait for the budget review, the spending review and stuff that's going to come out in the next month or so. Interestingly, that's very similarly timed to the LMC England conference, which will push a lot, I think, of the GPC's response to what's currently happening, and particularly collective action. He did, like you say, ask us to step down from that repeatedly. There were comments about that on a regular basis about actually work together with me, look at stopping down collective action so we don't punish patients. My question about the fact that actually he's intentionally then asking us to work unsafe hours by definition of that, because one of the things that collective action has highlighted this.
Well, he said directly that capping patient contacts harms patients. That was the language that he used in the room. So he's very firmly opposed to that particular part of the industrial action, if not the other bits. There were a few more questions, Gandhi, just to go over briefly. There weren't that many. So last 18 health secretaries have promised to focus on primary care. Will he make sure the rise in GPs matches the rise in consultants? So that's alluding to some projections based on the NHS workforce plan that show a big increase in the numbers of consultants and a very, very modest increase in the number of GPs over time. And he said he thinks they're going to have to look at the NHS workforce plan, despite having previously said that they were committed to it as part of the review they're conducting to produce their 10-year plan for the NHS. So, okay, watch this space.
So I guess the interesting to take up from that, the things that weren't mentioned in the speech or even in the Q&A section, no commentary about physicians associates, and obviously the plan to increase the numbers that were there, that was not mentioned in any way, shape or form. So good thing I didn't put it on the Streeting bingo, because then nobody would have got it, because actually it wasn't mentioned in any shape or form. But very much that was avoided or not covered in these particular speeches. Whether that'll come up in other places, we will see.
Yeah, and then final question was about the last government. The last government stopped the new practice fellowship. Will he restart it? And he said, "I'm looking at it." That was all he said, really. And I don't know if we'd taken the question about estates as well. So
that was the final question.
Somebody asked about estates. There's a lack of estates and rooms and buildings in primary care. Will he address this? So there's been 14 years of underinvestment in estates, etc. He identified the lack of capital investment as problematic. So okay. And the intention to prioritise capital investment in the future. But then he sort of put the brakes on and said, but there's a budget coming next week, and he seemed to want to manage our expectations down about what might be there. I did wonder if this talk in the language of capital investment and capital expenditure might allude to some changes for how that's accounted for on the government balance sheet. This is one of the things that is rumoured to potentially be one of the things that might happen with Rachel Reeves in the budget, but let's see. But that might allow for more spending on infrastructure and capital projects like buildings and IT. So that was it. So thoughts, Gandhi?
So an interesting speech, a generally positive speech in my view, covered a lot of the salient points that we needed addressing. No groundbreaking substance. There's nothing from this speech that's going to come out and say, right, this is going to instantly impact general practice. I think it's very much consolidation of some of the earlier stuff we've heard and alluding to some things that may be coming, but not covered today. I think the key thing is he wants to talk. That's the message I got from this. We will absolutely see whether that happens. It's still very early days for a new government, for him in position, in this particular position. But he has committed to coming back next year as well. So if he's still there, we will see.
We'll see. Yeah, so I guess he spoke about how he has already listened on GPRs and made a point of saying, I've listened and I've acted and I want to have a relationship, which was good. To me, he sounded, genuine. He sounded honest. He was quite good to watch in the questions, in particular. Seemed well briefed. Seemed knowledgeable about his brief, which is really, really good and straight talking. Didn't agree with everything he said, but I don't know. What do you expect, really? Actually considering expectations.
Yeah. So I guess, a positive start to Wes Streeting's tenure, I guess, as a health secretary and coming to RCGP conference. We will absolutely look to see if he comes back next year and obviously see where this leads us in the coming years and stuff. We are obviously going to keep covering the conference. We had our little Streeting bingo. Some people claim that they've got the full house, so we will see. If you haven't found me at the conference already, you need to in order to get that prize. There is a prize.
First person to come to Gandhi with a full house gets the prize.
And I suspect myself and Andy will cover the day 2 later on. Maybe even on the train ride home. We will figure that out later on.
Maybe we could do.
Yeah, we will see. So we hope you've enjoyed this summary of the Wes Streeting speech at RCGP Annual Conference 2024. If you want to check out some of the other content we've done today and recently, check out here. Alternately, we will catch you on the next time. Make sure you subscribe to get all that straight away. Catch you later.
Okay, goodbye.